Good morning. Thank you for joining us today to learn how mental health programs and services were impacted in the recent 88th Texas Legislative session. My name is Jamie Wasilowski, and I serve as the President and CEO of Methodist Healthcare Ministries. Most, if not all, of the folks joined today know of us, are acquainted with the members of our staff and the programs we fund in our 74 county service area. For those who don't, I'm proud to share that Methodist Healthcare Ministries broadens the definition of healthcare by providing low-cost clinical care for the uninsured and by supporting community-led efforts that improve living conditions that cause people to be sick in the first place. We use our earnings as co-owners of Methodist Healthcare to ensure that people who are economically disadvantaged and uninsured can live their healthiest lives. We do this by advocating for, investing in, and providing access to quality clinical care and addressing factors that affect health, including economic mobility, supportive relationships, food security, broadband access, and safe neighborhoods. Ultimately, we fulfill our mission of serving humanity to honor God by advancing health equity so that more resilient individuals and families living in the 74 counties we serve can truly thrive. Thank you so much for giving us some of your valuable time this morning to hear from one of our long-time partners, the Meadows Mental Health Policy Institute, about important new laws and funding impacting mental health in Texas. We're joined by Dr. Andy Keller, President and CEO, and Nelson Jaron, Senior Vice President of State Policy for the Meadows Mental Health Policy Institute. Our partnership with Meadows began 10 years or so ago when MHM convened key mental health stakeholders in Bexar County to study the delivery of community mental health services and its impact on our patients, providers, and hospital systems. That body of work guided our efforts to create the Southwest Texas Crisis Collaborative to address ineffective utilization of services for our underserved population. We pushed forward to develop a comprehensive, integrated crisis system across all major public payers, hospital providers, philanthropy, public safety, and behavioral health providers. Some of those mental health champions who serve with us on the Collaborative Steering Committee are with us today, and I would truly like to thank them for their commitment to providing our Bexar County residents with accessible and appropriate mental health care. As most of you are aware, the need for mental health, behavioral health, and substance use programs and services has greatly increased. Unfortunately, too many of us have seen and maybe even personally experienced the trauma and pain associated with acts of violence and loss of lives that are caused by individuals suffering from mental illness. The loss of any life is a painful tragedy, but most will agree that the loss of a child is something most families will never get over. We remember and pray today for the Uvalde community and the loss of their beloved children and teachers that fateful day. The healing process will undoubtedly require the love of family and community. It also requires greater access to quality mental health care providers, programs, and services. Addressing mental health was a top priority for state leaders this session, and we saw a number of bills filed that looked to increase access to services and providers in new and innovative ways, especially in our rural counties. The delivery of care through the use of telemedicine is here to stay. We are grateful to lawmakers for memorializing the delivery system into our Medicaid program in 2021 and expanding on those services this past session. The shortage of healthcare providers falls across all areas of medicine. Mental health is no exception. Lawmakers looked at ways to attract more providers to Texas through salary incentives, loan repayment, and interstate medical licensure compacts. Dr. Keller and Nelson will share some of the key wins this legislative session that will offer mental health services across rural and urban communities, including the expansion of programs that can address mental illness at the right time and at the right place. That said, we know much work remains and more investment is needed to address root causes and remove many layers of social and systemic barriers. Only then can we achieve equitable access to care for all Texans. I would now like to turn it over to Andy Keller and Nelson Jaron to begin our presentation.
Jamie, thank you so much. And Jamie, also thank you for the decade of partnership with Methodist Healthcare Ministries and with your many partners throughout South Texas. I mean, we're going to talk today about all the ways in which that partnership not only set the ground for being able to, and your work, really your work, set the ground and that of your partners to be able to continue to accelerate and do new things in South Texas to better meet the needs and to have more equitable access to effective care, but also how that information was critical during the legislative session for helping Texas leaders see what was possible and what people were willing to do. So I just want to thank you so much and thank you for that kind and warm introduction. And we're excited about the presentation today. And welcome. Thank you, everybody, for being here. Nelson and I are really excited to chat with you and share what happened in the last session. As Jamie said, it was an unprecedented session, but a lot of that was because of people that are here today. We have legislative offices represented here today. We have health system leaders, we have foundation leaders, we have community members, government relations staff who were involved. So I'm actually most excited about the 20 minutes we're hoping to have at the end for questions. So try to come up with some hard questions. Try to push us to answer something that that you think will be interesting for folks to hear about and continue the substantive discussion. So Nelson, let me jump in as we jump in. I mean, let me just ask you. I mean, our vision and our mission is really to look at that intersection between state policy and local systems within a larger concept of national policy. But I mean, you've actually lived through more legislative sessions than I have, despite your youthful appearance, because you started this sooner. And I'm like, how's this compared just like to any other session you've worked at? I mean, how was this different or similar, given some of the historic things that were done?
I think every session has a unique flavor or theme to it, but this legislative session, I think, was different since last session. 2021 was affected by COVID, and the Capitol was shut down for the majority of the session, and masks and entrance procedures to come into the Capitol, and many offices doing things virtually. So I think this was not quite back to normal as things were before session, but I'd say it was pretty close as far as the interactions down there and just kind of the feel of things at the Capitol. And of course, a once in a lifetime budget surplus again due to COVID. The combination of federal revenue that was given to the state, as well as much greater than expected revenue coming in from people continuing to buy things despite COVID's impact on our economy. So,
yeah, I mean, Texas really bounced back quicker than a lot of other states did and did some amazing things. I'm trying to remember, when was that exactly when we got that kind of eye-popping estimate from the comptroller about how much revenue there was going to be? Do you remember when that was? It was like
there was a couple updates and hints during the interim. After the last legislative session, of course, the comptroller had to certify the budget estimate, but I believe that was the first time where we thought that they still had some cushion in there, and things just steadily kind of increased over the interim until the comptroller formally issued his budget estimate for the legislature in January. When it was official, of course, that number in January is what the legislatures can actually spend. So when he gave that number, then we knew that was set in stone for this legislative session and this budget cycle.
Yeah. Well, let's do the top line. Let's hop down to that next slide. So the top line, y'all, this was the biggest investment in mental health and substance use disorder services, not just in Texas history, but by any state. And, the media likes to, get these one-liners about is Texas last in funding? The people still like to churn up all sorts of analyses to try to categorize, a big state like Texas, somewhere. The reality was for the last going into the last time that there were actually data, because all these things that look at national things look at like where were we as of 2019, 2020. Pre-pandemic, we weren't last, but we were in like the middle of the pack. We nothing to be proud of, nothing I would call my parents and say, look at us, we're doing awesome things here in Texas. But with the investments that have been done through the pandemic in 2021 for youth, and then with this session, I mean, we can, I think, proudly all know that Texas is investing more in an ongoing way in children's mental health and in rebuilding and expanding our crisis response system, including hospitals and crisis services, than any other state. And I am 100% sure that's true. And if anybody wants to talk about that during the Q&A, we'll chat with you about why we believe that's true and what some of these other folks who say other things are getting into. But this was truly unprecedented. And it wasn't just last session. I mean, I think if you look at that, the investments that have gone in since we've been, we can only look at what we've been part of, going back to the 84th legislative session. And that's when the state started counting officially, which was one of our early wins, working with Senator Nelson and Senate Finance to get those riders in to actually count how much mental health money is being spent. But it's basically a 77% increase since then in terms of funding, and an unprecedented jump in funding this time. So, I mean, Nelson, I have to confess, I knew it was going to be an awesome session based on the funding and based on the momentum that was coming into the session. But I was surprised. I mean, were you a little bit surprised or no?
Sure. I think, this funding is really from two different things. First, if we just look at House Bill 1 this session, which is the General Appropriations Act, or the budget for the next biennium, so the 2024, 2025 fiscal years. If we look at that, that's right at a $1.25 billion increase over what Senate Bill 1 or the previous budget was from the 2021 session. So if you just looked at that number, you would say that was a historic increase. I don't think I can pretty much certainly say there's never been $1 billion increase. I think there was one legislative session where it was 900 million or so a few sessions ago, 800 or 900 million. So it got close, but that was that and then some. But then on top of that, the supplemental budget, there's always a supplemental budget that backfills shortfalls from the previous biennium and adds additional funding. And this has been one way the legislature has invested one-time expenditures over the last few fiscal years, particularly towards redesigning our state hospital and expanding our inpatient capacity. And Lieutenant Governor and the Senate in particular have been key leaders in that effort. And Lieutenant Governor came out last fall, I think in October, at his press conference and said, I've got a plan and I'm going to spend, I think at that time was about $2.1 billion on investing in new facilities. And ultimately that supplemental budget, the total number came to a little bit over $2.3 billion. And that is the inpatient facilities, crisis facilities, children's hospital beds we'll talk about in a minute, as well as additional funding for the Texas Child Mental Health Care Consortium in there. So when we add those all together, that gets us to a whopping $11.68 billion that the 88 Texas Legislature invested this legislative session and for the next 2 years.
Pretty exciting. All right, well, let's dig into the details, y'all. So, Nelson mentioned the inpatient builds, and I do think we all need to be appreciative of the Lieutenant Governor's leadership on this. This has been something that the Lieutenant Governor has prioritized over multiple sessions, that original plan. And I think it's also important to understand the role of San Antonio and South Texas in that. Some of y'all may remember back in the original phase of builds, San Antonio wasn't on the list. People knew that they were going to rebuild in Austin, and that was going to be one of the first focuses. But there were other communities that, frankly, were better positioned in the lead up to the legislative session to be able to, have a shot at that first round of building. And the efforts, I remember MHM did a pre-legislative briefing, and you had some pretty important community members there. And when I talked to them about that, can you go back to the last slide, Justin? Thanks. When I talked to them about that, people were like, "What do you mean we're not positioned?" And we're like, "Well, you're not." And so y'all got positioned. I remember that first meeting that was in the planning that came out of that session, post session. I don't know, was Nelson, you were there, with 30 people showed up or 40 people from San Antonio saying our community's ready. We want to be one of the first ones to build a psychiatric hospital.
Yeah, there was a large contingent. I know Chris Yanis was there and others from Methodist Healthcare Ministries. And of course, we had Speaker Joe Strauss from San Antonio at that time. And I think they showed up in his office, but they caravanned up 35 North to come make their point heard. So.
And it was. And, and I think that was really an important early example of the influence of San Antonio and South Texas more broadly within the legislature. So this session, when we came in for the newest round of builds, you all started getting through the Southwest Texas Crisis Collaborative through STIC. You all started some intensive planning in the fall, which I don't think another community could have done. I mean, you all came together with a multi-pronged plan about how to make additional investments in South Texas that I think was critical, because those 17 unique construction projects plus the community grants, which we'll talk about those in a sec, those weren't on anybody's radar. There were basically 4 builds that were on the original plan, 2 of which were rebuilding old state psychiatric hospitals and then 2 new facilities. Because of the input of your community driving planning in much more detail, which was unpleasant at times. I mean, there were some tough legislative hearings where people were like, what do you mean you're asking for more? And you're like, yeah, we need more. And you all bravely did that along with other communities, and were critical for being able to shift the discussion to a much broader plan with 17 construction projects currently underway and this $100 million that's sitting there for additional grants that I know through the Southwest Texas Crisis Collaborative, you all are poised to put some of the projects that you didn't get made out there. You also got some maximum security capacity that's going to be built here in San Antonio to also be able to help. So there's a lot of stuff out there to be able to address the crisis that we have of too many people languishing in our jails, too many people meeting tragic outcomes in our communities because those individuals and their families and their communities lack access to needed inpatient care and needed crisis care. So I hope you all feel proud of this. I hope you feel excited about what's going to be able to be done in your community around it through just these building things. And I was like, how do you think, I mean, I guess I do feel a little sorry for HHSC having to manage this many projects. I mean, it's kind of amazing. I think they're ready for it. Hopefully they are. But, what's your sense of just, have you ever seen anything like this comprehensive of a plan?
Absolutely not. I think in HHSC, I would say to their credit, they've been on top of the ball on getting these projects off the ground. I mean, I know they were reaching out to communities as soon as the legislative session ended, when the ink wasn't even dry on these bills, already communicating with them and making sure that they hit the ground and get these planning and design effort and getting cranes and construction up and going as quickly as possible. But just historically, if we think back, the 2016 interim is when these discussions really started, and it was driven really by the Canon Design Report. We have 10 state hospitals, and the Canon Design Report had been done before that, and it showed that 5 needed to be bulldozed. They were beyond repair, and 5 needed significant renovations. And when the legislature in 2017 made that first commitment, it was $300 million, and it was going to be a 3 biennium plan. So $900 million after 3 legislative sessions, we were going to be done. With this bill now and adding that up, they've now allocated over $3.6 billion. And so from where we started, it was really, Kirk Watson and Donna Howard and other key people from Austin leading the charge on the Austin State Hospital, and Senator Nichols, a dog with a bone on Russ State Hospital, wanting to get that rebuilt. Those were 2 that were on the Canon Design Report for bulldozing, and they were right at the front and center of that. And then we mentioned how SASH came in there. They were also on the bulldoze report as well for that Canon Design, and so they got the funding for that initial planning. So those 3 is where we really started at. And to come to this, you mentioned at the beginning of this session, when they put out their initial plan in the budget, it was just really an informational rider. It wasn't funded yet, but it kind of reflected what the lieutenant governor said in October, that they were going to spend roughly $2.1 billion. And as you mentioned, they started out in that initial plan. They proposed to rebuild Terrell State Hospital, Wichita Falls State Hospital. They proposed a new large hospital in the Valley, in Rio Grande Valley. And the 4th one was in the Panhandle. It was just like a $450 million allocation to the Panhandle without any details. So over the session, the House and Senate went back and forth, and communities came up like San Antonio did with their idea, and the other ones we'll mention here. And ultimately, it went from 4 initial marker to 17 unique construction projects and these different grant opportunities. So specifically, just to hit the details on that, there are 17 unique construction projects. They go everywhere from El Paso to Victoria, Montgomery County, all the way to the Panhandle, Dallas. So it really covers every area of the state. Wasn't going to go into details of all those, but so I'm really targeting the things that affect the 74 counties of the MHM service area here. And so that's why front and center, we have the SASH on there, that there's $15 million in there to rehabilitate the Alamo Hall facility and dedicate that to specifically maximum security patients, which we know the Bexar County Jail and many other jails across the state have a backlog of those. So that'll be a local access for y'all. Right now, the closest is Kerrville State Hospital. That was a previous session's funding. They rehabilitated 70 beds over there and they were having trouble hiring. But just in this spring, with some additional dollars that the governor and HHSC allocated, they've been able to start bringing those new max security beds online. So addition to that, in the region, the broader region there, the Rio Grande Valley, I mentioned that was in the original plan, but the original plan was about $450 million for a really large scale build in the Rio Grande Valley. And what they did, I think, is strategic for a workforce perspective and also for a local need perspective. They settled on $120 million to build 50 max security beds for the Rio Grande Valley. So again, there's no max security access in the Rio Grande Valley now. So that'll be helpful to San Antonio and the broader region as well, because the people from the Rio Grande Valley won't necessarily have to come up and use those new beds at the Alamo Hall facility, since they'll have their own facility down there. They also, in the plan, they did a lot of public-private partnerships, and this Rio Grande Valley build is one of those. That's going to be with a hospital system in the valley, $85 million to construct 100 beds there. Because of the forensic wait list, there was a requirement or a attachment with a certain forensic floor with these builds. And so they have to have at least 50% of those beds being forensic for the new facility going in the valley. So you'll have two separate facilities there. One maximum security facility be run by the state, and another one that will be run by a hospital partner in the valley. Similar proposal, the public-private partnership with a hospital, Victoria County, 60 additional beds there, again, with that 50% forensic component. And then we'll get into details on the next page on this, but Uvalde has got $33.6 million for the new Uvalde Behavioral Health Center that's actually going to be built in Uvalde. So, and then the two grant programs, Andy, you hinted at those, but it didn't just have these unique construction projects. And I think the reason for that, during session, there was a lot of people that were coming forward and saying, I've got this idea for a crisis stabilization facility, and we need $15 million for this crisis stabilization facility. So what can we do beyond strictly inpatient psychiatric beds? So the legislature ultimately allocated $100 million, and these have to be county-based collaboratives. So it hasn't been designed how this is going to go out just yet, but the model is really after the Senate Bill 292 grant program that we'll talk about here shortly, which is a partnership between the county, the local mental health authority, and the hospital districts that they have there. And the matching requirement for these is similar to the 292 program as well. But these are for things other than inpatient facilities. So jail diversion units, step-down facilities, crisis stabilization units, crisis respite units, supportive housing. So as Andy mentioned, the STRAT group and the organization y'all have around that, I think you're very well positioned for that funding. And I'm sure there's other people in the MHM service area that can take advantage of that as well. And then finally, the children's grants, $15.9 million. This is something that the Children's Hospital Association of Texas had been working on back since 2021, particularly around the one-time ARPA funding that was given in the third special session. The children's hospitals, due to the increased mental health needs during COVID, we're seeing a lot of kids, particularly younger kids, kindergarten age, and similar, presenting in their ERs with severe suicidal ideation and mental health distress. And so they ultimately were successful in getting $15.9 million in there to go out as grants to add children's hospital bed capacity across the state as well. And that one is supposed to be imminent as far as release, but it hasn't been released just yet. So,
yeah. It's exciting, and add up how much that is. This is just, the South Texas impact, and hopefully you can get as much of all those community grants as possible. And I'm pretty sure, won't the community grants also pay for extended observation units, Nelson? 23-hour obs?
Yep, that's an acceptable use in there as well. So I would think of it as anything across the gamut of crisis system that's not a inpatient, psychiatric bed like a state hospital facility or a intensive psychiatric hospital would be. So.
But there are ways to pay for more hospital beds. Let's go to the next slide. So the next slide is also really important. And this is the additional community purchase capacity, which again, the Southwest Texas Crisis Collaborative was critical to advancing the argument that we needed more by being able to show how much we needed for the San Antonio region and also other needs in the area, because they were also able to incorporate information from surrounding counties. And then also the rate that's paid, because every day there are inpatient beds that are not used because of a lack of not just funding, but funding that's at the rate that we need to pay for that. So it's pretty exciting to have this much out there. to be able to fund more. And I know the community is positioning, but this is something the entire region should be looking at positioning to be able to build additional. I mean, if you put all this together, I mean, it's the biggest crisis inpatient investment I've seen anywhere. Nelson, you want to go through some of the details?
Yeah, when we look at that, I won't read from the slide here. I think these will be distributed later. I'm sorry, afterwards, if you guys want to get into details. But if we look just at this first 3 bullet points there, that is $333.9 million between those. And so it's really broken into 3 things. Purchase psychiatric beds, or PPBs. These are beds that go out through the local mental health authorities. So Center for Healthcare Services in Bexar County, or Tropical Texas in the Valley, for example. They get an allotment based on their kind of distribution around the state, and they're able to use those to then pay people in the community for those beds on a per bed per day basis. And so that funding did 2 things. It increased the rates because we knew with the workforce challenges and just inflation that you need to be able to pay a higher rate to the community. And then it expanded the number of beds available by that 193 additional beds. And they're dividing that specifically in the budget. They specified that 123 of those had to be for urban and 70 for rural areas. And so that's our PPB beds. But that second line there was important too, going back to the forensic wait list, 150 new competency restoration beds. So this is similar to PPB, but this is for people that are in jail, incompetent to stand trial, and they're waiting on the state hospital wait list. And so the legislature has invested in 150 essentially contract beds that can be available out in the community for competency restoration services. And these are actually being run through Scott Shacklin's shop, who's he oversees the state hospitals and state supported living centers. He's reached out to counties, and I know Bexar County is one of those, as well as our medical schools, and is working on partnerships in the community to see who can ramp this community up, or this capacity up, as soon as possible. So other people that are here from those groups, if you have capacity through your local communities, you can reach out to Chris or us for follow-up, and we can tell you, who to get in contact with to think about how you can utilize those funds for your community. And then finally, this third line here, this is what I would call quasi-state hospital capacity. So we have our state hospitals that are run by HHSC employees, but you also have these quasi-state hospitals that are run by partners. And so they added additional capacity through these partners, roughly 36 beds there between Palestine and one other facility in the state that is run by a local community partner, but is not an HHSC facility. So that also expands our forensic capacity to help with our forensic wait list. And then these last 2 here, these were separate funding streams. They actually recently went out through the Rider 52 Needs and Capacity Assessment, but this was funding for operations for those crisis stabilization facilities. So the previous page on that community grants, that would be actually brick and mortar facility costs for building crisis stabilization facilities and otherwise. These are operations dollars. So the goal is to fund roughly 5 new crisis stabilization facilities across the state. But again, that's broadly defined. The EOUs you mentioned on the last slide, diversion centers. But again, those are operations dollars. And then finally, for the children's side, similar, $11.5 million to fund 4 additional crisis respite units for children. Again, operations side on that. If you wanted to build something, that would be on the previous slide through the community grants component.
So well done. All of you who advocated, you were successful. And I know you wanted more. We always want more, but no one has ever gotten this much before. And the thing you got to do is go implement this stuff, because if we don't implement this stuff and move it forward, then we're not going to get the next round we need. So we went into a lot of detail on these because we wanted you to understand them. We're not going to go into as much detail in the remaining slides because, as Nelson said, you're going to get these slides to read later, but we're going to try to give you sort of some of the big picture things here. One of the biggest ones is the Uvalde response. And, I just have to, Jamie's points earlier, I mean, this is, this wasn't that long ago, y'all. We're still in a very difficult place in terms of the healing, not just certainly for folks in Uvalde, but on the region and our state. This was a terrible, horrible blow. The state did work collaboratively to support Hill Country and community leaders in trying to determine what is the way that we can put supports in place to respond to the community, but also to put the community in a better place going forward around the entire array of mental health needs. So this large investment that is going to be made there, the original down payment was made on that last summer. And, and then the down payment was translated into the details that are laid out here, which is a very regionally tailored and developed plan that stakeholders, and the thing I was probably happiest about was that the Uvalde mayor and the county judge said, this is what our community needs in their cover letter for the assessment that led to this. And the legislature responded by really trying to provide what that community had asked for. So, Nelson, you want to highlight any of these details?
Yeah, I think the centerpiece of this we mentioned on the previous slide was Senate Bill 30, but that assessment top line recommendation, and we really believe this is a model for rural communities, was this new Uvalde behavioral health campus. So Hill Country Local Mental Health Authority is going to be relocating their offices out there to this campus. The local government, I don't remember if it was the county or the city, they donated the land for the build out there. But the important thing is this Uvalde campus is a 16-bed crisis for adult and 16-bed crisis for kids. And so not as intense on the staffing requirements as you would be building a inpatient hospital out there. So that was a key component of it, thinking about how they can staff the workforce out there and what would be right size for the community. This old notion of building massive state hospitals with 250, 300 beds in the middle of nowhere is not going to work in today's age and with our workforce. And so I think this was the right size fit for the community that can be replicated in other areas of the state. We talked about the community grants being able to fund crisis facilities. So this is kind of what other people, particularly in West Texas and the Panhandle, they were picking up on a similar model and looking for funds to augment their kind of local capacity there with these type of builds. But ultimately beyond that, there's funding to bring this campus online. It's about 18 months that they think that it'll take to get this open. So the back end of the biennium, the operations dollars to operate it, some PPB or the purchase psychiatric beds we mentioned, having those specifically for the Uvalde region because they have little to no capacity right now. It's all in Bexar County or elsewhere that they would have to go to get that capacity. So these are some dedicated beds for them. And then continuing what they did in June, just providing targeted funding for additional mental health services and needs that community has as part of their recovery. So there's the key highlights, but they were, nicely in line with the mental health needs assessment that was released in December, right before the legislative session began. And everybody was really in sync about getting Uvalde what they needed, whether they were from the community, like Representative Tracy King on that, or Senator Roland Gutierrez, but Dr. Bonin in the House, Senator Huffman in the Senate, and everybody else on House Appropriations and Senate Finance really rallied around the Uvalde recommendations and the needs for that community. So.
All right, cool. Well, so thank you, I think, to that region. I think the thing I would like to just know in what you said, Nelson, is other communities should be thinking about this because that campus includes partnerships with the community college there to train the workforce we need. So this sort of community investment, I think, hopefully is a model exactly like Nelson had said. So moving on. Children were the other big response. As you recall, in the governor, lieutenant governor, and speaker's response initially to Uvalde when folks came together in the last summer during the interim, the summer of 22, there were some down payments on things and an emerging plan that to respond more to children in need. And so the Texas Child Mental Health Care Consortium is the cornerstone of that. It was stood up in early 2020 with funding from 2019 and has expanded now to where it's going statewide. And, it's important to keep in mind that it provides supports in primary care, but also in schools. And the TCHAP program now has over $170 million for the biennium to basically be available to any willing school district in the state. Over 5 million students will eventually have access to this over the course of this biennium in an ongoing way. And so, UT Health San Antonio, critical partner in the region, UT RGV, a critical partner in South Texas and in the Valley. And so being able to have that infrastructure available to any willing school is critical. We're going to need you all helping make sure that schools get their questions answered, because schools have a lot to do beyond being able to meet the mental health needs of their children. And this is a chance for them to have the world-class support, same-day response from a child psychiatrist for a student that they're very worried about. So this is exciting, and to be able to have it statewide, no other state has this. And so if you're ever reading about state Texas and feeling bad that we people who say we aren't number one, tell them we are number one on this, because I promise you there's not another state that's made this promise to every school child. And we're excited. We hope other states do. We're happy to have other people join in this, but this is incredibly important. And I just can't thank the medical schools in the region and the medical schools statewide enough for taking this on, as well as for their local mental health authority partners like the Center for Healthcare Services, Tropical Mental Health, being able to be there alongside to be partners in this. So it's amazing, the investment that's been made in this. And it really, Nelson, was the work over multiple sessions. I mean, 3 sessions of work to get the consortium to this stage.
Yeah, and it was passed in 2019, and we had a little something called COVID that happened after that. So standing it up in the middle of COVID and trying to do outreach to primary care and pediatricians for the CPAN or the school districts for TCHAT. So, and this is, I wanted to show everybody, speaking of that, what they've done. You can pull this up. You can go to the consortium's website to their TCHAT page, but this, I just tried to take a picture as close as possible. I know we got part of Houston in there, but as close as possible to reflect the MHM service area. And this is current coverage of TCHAT as of now. You go to the website, you can actually see down to the campus level through ISD, elementary, junior high, high school, exactly who's enrolled. So you can check and see if your local ISD is already enrolled or not. But they're covering more than 5,000 campuses, 3.3 million of our students, which I think is about 60%. And as Andy mentioned, they have the funding this legislative session. The only restriction is going to be workforce to get there, but the funding is there to get this to any willing school district in the state of Texas over this biennium. So we expect that more than 5 million of our Texas K through 12 students are going to be covered by the end of the upcoming school year, the 24-25 school year. So,
but we're not going to let workforce get in their way, because they got to deliver on this one. This is going to be the priority of the workforce. So, but you're right, it is an ongoing challenge. Yeah, isn't that so? All those white spaces are going to get filled up, y'all, and that's your job, is to get your communities engaged, because we did not have any school district left behind on this. They all there's not a school district that couldn't benefit from this. There's some who have their own services, but we really do need your support in this. Let's go to the next slide. This is the needs and capacity assessment that just went in last week, where local mental health authorities worked with community partners to say how much of the intensive service array can be built up. Because TCHAT's great for identifying needs and for stabilizing needs and for being able to get folks to the right place. But someone with severe needs, someone who might hurt themselves or might hurt other people, or someone who just is going to have a really deteriorating experience in school, maybe drop out of school, maybe have outcomes that put them and their family in a bad position. These are the services they need. And these are the evidence-based intensive services that the state's investing in. And the state, I mean, we need actually a lot more than this. The reason the state made this initial investment at this level was because workforce-wise, there's a concern we can't ramp up any faster than this. I'm pretty sure that the requests for this are actually going to exceed what was there, but that's good, because it shows that communities are ready to do more. And we also believe, through partnerships with local foundations, with local governments, with county probation offices, there will be a way to meet even more needs than what's going to be met through this initial set of investments from the state. But multisystemic therapy is the evidence-based therapy that works for children and youth, really for youth who are at risk of violence. And I'll tell you, I've said this before, I said it in a hearing, I'll say it in front of y'all. Had this been available in Uvalde for the Uvalde shooter, this service would have had a 75% chance of preventing what that young man ultimately did. And there's tons of evidence, and happy to discuss why we stand so firmly behind that claim. The other thing that puts youth at risk is psychosis. And the gold standard for treating psychosis that Texas has ramped up tremendously across the state, but which we're leaning into now for younger people, because it can start as early as age 15, is coordinated specialty care. And then finally, we can't wait till youth end up in hospitals. First of all, we don't have enough hospital capacity for youth and their families. And we have youth boarding in emergency rooms, or suffering in the community, or having to stay in foster care placements that eventually fall through. Youth crisis outreach teams are essential for being able to stabilize needs and follow families, not just during those first few hours when the crisis is happening, but really for up to 3 months after that. So we're excited about the communities that stepped up and put in for the initial round. We know many of them will be in South Texas, and we want to use this to really begin to meet more needs, but also to prepare for ramping up even further next session. So, Nelson, anything to add on that one?
Yeah, I think the only thing I'd add is, this just shows how quickly we talked about HHSC is working to get the funding out. The legislature just adjourned in May. This needs and capacity assessment went out in July and closed last Friday. But the organization of the local communities, STRAC and the Southwest Texas Crisis Collaborative in particular, I presented to them in June. They were already looking at all the funding that came out from the legislature, not just these funding streams. And so when this NCA dropped in July, it was surprising, but they were ahead of the curve because they were organized and they already had, kind of worked together and determined what they wanted to apply for and who those community partners were. So I think just the, twofold again, how quick this funding is going out and the importance of organization of your local community and knowing what your gaps are and what you want to fill next and taking advantage of those opportunities as they come. So.
Yeah. So I'm so glad you said that, because I guess got to say, Deputy Executive Commissioner Gaines and her team did an amazing job getting that out. And the local mental health authorities, the Center for Healthcare Services, Tropical Texas, folks throughout the Valley, folks throughout South Texas really stepped up and did an amazing job. And, I'm sure there's going to be some needs that don't get met, but I think we're going to do as much as we can and hopefully set the stage for doing even more in the next session, which, we expect to have more investment then. Just like with these programs, these mental health grant programs, these first went into effect in 2017. And the state has continued to invest. And this is something too, when the state took this on, when Commissioner Gaines took this on, she had no staff. She was given no extra staff to oversee this. And so she really relied on her team there and on her local mental health authority partners to build these out and to broaden the reach, because these go way beyond just the mental health authorities. They go out to community partners across the state, counties on the justice piece, other folks, children's providers on some of the community mental health grants, and adding this new innovation grant program, which I'm going to let you talk about here in a sec, Nelson, because you understand that quite well and we're very involved in that. But the continued investments in this and the growth over time is what we expect to see in the MST and coordinated specialty care and youth crisis outreach teams. We expect that investment to increase over time too. And it's exciting to see these opportunities. Dustin, do you want to talk just a little bit about the increases, but also about the new program?
Yeah, just briefly. I mean, we have more grant programs than this. We also have the Healthy Community Collaborative that funded down in San Antonio, the homeless center down there. But these, I just wanted to hit on the increases on specifically and make people aware that these fundings are coming down the pipe and you need to get prepared for them. So that first one there, the Mental Health Grant Program for Justice Involved Individuals, that's Senate Bill 292. If that number more rings a bell with people from the 2017 session coming out of the Select Committee on Mental Health. That was Senator Huffman's bill and Representative Price in the House. That second one there, the Community Mental Health Grant Program, that was House Bill 13 from that same session. So that's targeted towards gaps in the community for both children and adults. Nonprofits and governmental entities are eligible to apply for that one. And then this Innovation Grant Program, it's actually going to be known as the Mental Health Early Intervention and Treatment Grant now, but we'll call it the Senate Bill 26 grant because it came through Senator Colcourt's Senate Bill 26 bill. And this is out for rulemaking right now. So the comment period is due right around the Labor Day weekend, but it was published in the Texas Register here, and that was a requirement in the bill to publish the rules and guidelines before this funding goes out. But the legislature put $30 million additional into this, and it's targeted towards children and families, juvenile justice, child relinquishment, the kids that are in crisis we talked about ending up in hospitals. And it has a broad array of people that are eligible to apply for it. So it's everything from local mental health authorities to hospitals, child care facilities, counties and municipalities, nonprofits. So there's about 8 different things written in statute, but I would highly recommend checking out the Texas Register. It's very close and in alignment with the actual statutory language of Senate Bill 26. So I expect it to get formally adopted and this to be pushed out. So these are 3 things coming down the pipeline to get ready for very soon, I would say. With the new fiscal year, of course, kicking off September 1st, I think they're going to want to get this funding out as quickly as possible.
Yeah. So please do that and look across the region. All right. So we've talked several times about the workforce, and what we said in our opening, we actually said it at Engage and Excel last year. In my opening comments, we said it at every hearing we were at with the legislature, both in the latter part of the interim as well as during session. Our biggest limiting factor is our workforce. And it's not just us. This is the nation's issue. I mean, you read about it, national newspapers. We don't have enough clinicians. And there's 2 reasons for that. One is that we need to invest more, and we need to invest more in training. We need to invest in training, not just in psychologists like me, but in mental health technicians, bachelor's level and AA degree level individuals who are earlier in their career. That was my first job, was working in a hospital, just being a person who tried to help out, supporting the nurses, supporting the physicians. Those are critical positions. A big reason why we have so many inpatient beds offline in the state system currently, in addition to the difficulty of the state operating its system. But just because it's hard to operate a state system. But the other piece is the workforce is in the wrong place. And there's a question in the chat about this that we'll get to, but talk about more, but we intervene 10 to 11 years after symptoms emerge. So it's not going to be enough we can't staff enough hospitals. We can't staff enough crisis services to continue to meet the ongoing need on that. We will be able to ramp up what's in the session in this year, but we really have to begin to look at not just building a broader workforce, but by putting that workforce in different facilities. So we're excited about this. Frankly, we would have liked to have seen more. We would have liked to see more go to the local mental health authorities on this. We think they're going to be able to do some cool things and important things, probably hopefully enough to be able to get through, especially with some of the other funding that came through. And we're very hopeful, but kind of guardedly hopeful about the ability of the state hospitals to use their salary increases to ramp their capacity back, because we think salary increases are part of the challenge there, but part of the challenge is the difficulty that the state has operating facilities. It's just not, states aren't designed to operate facilities. They were back in the day, but the current reality of inpatient operations really requires a much more dynamic, place-based and rooted management approach, like the hospitals that comprise the Southwest Texas Crisis Collaborative. So we're excited about this. I'm also excited about the continuing investment in the loan repayment program, because Nelson, y'all put that in place in did you put that in 17 or 17, right? Or was that when you put that in place when you were Senator Schwartner, or was it before 17?
It was 2015, Senate Bill 239. And the key thing about that had been at $2.1 million since Senator Schwartner passed it. And so that was a $25.9 million increase they put in this session. And it had a 5-year glide path for repayment. And so the people that had applied years ago were essentially tied up and eating up all that funding. So this was a giant increase that will make a lot more availability for this. They also, I've listed these other bills here. Key things, there's 3 different bills that affected this loan repayment program. It added employees of state hospitals, like you mentioned, and local mental health authorities are not eligible for this. So you don't just have to be in a mental health professional shortage area. They also took the repayment period down from that 5 years that I mentioned down to 3 years. So you can get a third of repayment each year over a 3-year period. So the last thing I'll hit on this Workforce Innovation Grant Program, that was a priority of the speaker. Came out of the speaker's office. They just ran out of priority bill numbers, so they assigned House Bill 400 to it. But that was Representative Stephanie Click and Senator Colcourse carried in the Senate. But the way the budget negotiations were going at the end there, unfortunately, there was supposed to be funding provided for this, but it got left off the list. But it is law. And when we talk about growing our workforce, it was divided into 2 different pots of money. One money was going to go to medical schools to expand their ability to train psychiatrists. The other was going to go to our universities to expand the ability to train everybody else. So counselors, social workers, marriage and family therapists. So it's law, but because of a snafu at the end, there was no funding in the final budget for it. So this is really something that next session, hopefully people can advocate for those 2 funding streams to get money put in them, so we can expand our ability to train more people and not only put people that are currently in the workforce, redeploy them, as you mentioned, but train the next generation of our professionals as well. So.
Well, that's exciting. So let's, I think that's it. That's our last prepared slide. We really are excited about the questions that have teed up, which we are to right on time. Ms. Giannis, are you going to join us? Good to see you. Thank you for all your collaboration over the years. It's a fun teaming with you and your team at Methodist Healthcare Ministries. So it's fun now to team on these Q&A.
Same. Andy and Nelson, thank you all for a great job. And can't believe it's 10 years since we've been working together and getting things started. We've got so far about 3 questions in the queue, so I'm going to get those quickly to y'all. Valentina Fernandez says, can you talk a little bit more about the intersections we see in these additional funds in capacity in mental health and in housing? Is it in the community grants that can be used for supportive housing?
Yeah, so housing's tricky because housing is primarily a local funding issue and a federal funding issue. There are some states that have made investments, and certainly the healthy community grants that Nelson talked about that go to some of our larger metro areas can help with that. But I mean, I just to be candid, the state does not do a lot. I think the way to think about it, and I think the city of San Antonio has been a real leader on this about how do they take local funds and how do they partner with essential community providers to make sure that the housing's being funded locally and with HUD funds, and that all of the supportive services, which is really what the state has funded. I mean, I think I would think about this as the supportive basically any supportive service, mental health service that a person who's homeless would need has been funded. You know, there's funding for that. But the actual housing outside of those grants, Nelson, are they still funding that other grant program, the one that
yeah, that's what I mentioned briefly earlier. It wasn't on the grant program page, but the Healthy Community Collaborative, and I drew a blank when I was on that slide, but that was the model. Haven for Hope was the model for that. It was a public-private partnership for homelessness. And originally it just targeted the urban areas, but I believe 2 sessions ago, they expanded it to rural areas, but the funding had always been the same as at $25 million for biennium. But this session, they did increase that $8 million additional dollars. So there's $33 million total in the Healthy Community Collaborative this session.
Yeah, so I think that rural piece is one to look at. And that's something that there was another question that came up, I noticed, Chris, about funding things like the Southwest Texas Crisis Collaborative. That's the kind of collaborative, multi-agency collaborative that can get funded through that because it funds collaboration. And I think, so I do think there's some ways to put that together, but the housing itself, the housing funds themselves are still primarily local and federal. So you're going to have a really strong partnership with your local housing authorities and the other folks that are involved in that, and your municipalities that are investing in that, and frankly did increase their investments quite a bit during the pandemic, and hopefully can sustain some of that with these additional supportive funds.
And that community grant program that we mentioned, the Senate Bill 30, the $100 million, supported housing is an option under that as well. Of course, $100 million across crisis units, EOUs, diversion centers, and supportive housing is not going to go far, but that is an allowable use of those grant funds. I
will tell you though, and this gets to another question, when you do go head to head with stuff that can be more, I mean, supportive housing is fantastic. It prevents crises. We all, many of you, the reason you're asking these questions is how important it is. The state does look at that wait list though. And that wait list, which is, is it over like 2,000 people now? People in jails waiting to get into hospitals. That's what they're worried about for good reason, because those folks are in a terrible position. So I do think when you think about the competition, I mean, while I would like people should be looking at supported housing, if you put in a supported housing bid and someone else puts in an extended observation unit, you're going to be hard pressed, I think, to explain why your supported housing is going to divert more people out of the jail. But do it. I mean, we're not trying to discourage you. You just need to think about what are the criteria the state's interested in awarding those funds.
Thank you, guys. And we have another question from Sebastian. What percentage of the increased mental health budget is dedicated to early intervention and preventative services versus crisis management?
Yeah. Well, so the answer to that is a lot more than they used to, but not enough. That's the high point answer. But so think about it. We're those 2,000 people in our jails waiting to go to hospitals are, I mean, it's a travesty. And Texas isn't alone. I mean, this is the case in every state. Our nation as a whole has failed to live up to our commitment to our community members who are in need of, who have severe mental health needs. So we can't leave folks behind on that. We have to do better. And finally, I think we've put all the pieces in place to actually now have resources to address that travesty. That being said, there was a huge pivot in 2019 through the consortium, through the medical schools. And the whole point there is to get into primary care, where at age 8, we should be screening for anxiety. At age 11, we should be screening for depression. And those families whose kids are beginning to manifest difficulties are the same families who later on are likely to have these more severe needs like psychosis. So if we can start that early detection pipeline, we can. So the state has now fully funded CPAN, the Child Psychiatry Access Network. The state last session funded adding collaborative care, which allows for primary care integration of mental health for children and adults. And the state has now fully funded TChat so that every school has an easy button where they can get needs when they detect them. So I would say when that's in place and fully up, we're going to have the infrastructure for an adequate early intervention system, but we're going to have decades, well, not decades, hopefully not decades, hopefully half a decade, building out actual clinicians in primary care, full detection across all of not just our safety net providers, but all of our primary care providers, and then being able to partner with our schools and then fill out the intensive needs that many young people have. So I would think of everything through the consortium and all those Rider 52 programs. That's getting upstream, but the only one that truly, to me, is early intervention is the detection in primary care, and the promise of being able to ramp up integration in primary care, which I think the state believes in and wants to make investments in, but we just have these other pressing demands that have been languishing for over a decade, more than a decade, really forever at some level, and that need to be invested in. So, Nelson, did you do the math in your head about how it breaks down between the children?
Yeah, I didn't do the percentages out of the increase there, but I mean, it's night and day different from when I've been around. I remember 2015, I believe it was, Representative Senfronia Thompson, Miss T, had a bill, and all it would have done was authorize reimbursement at wellness checks for a depression and anxiety screening in primary care. And that bill passed, but it was very difficult to get that passed. And then with the events before the 2019 session, Hurricane Harvey and the Santa Fe school shooting, children's mental health became an emergency item for that legislative session. And since then, I mean, many of the things we talked about today, whether it's children's crisis respite beds or it's multi-systemic therapy, coordinated special care, youth crisis outreach teams, those are all targeted investments for children's mental health that were non-existent or not even discussed at the legislature 5 or 6 years ago. So I don't know what the percentage is, but it's growing and it's a lot more significant than it was before. But again, we still have the crisis and the forensic wait list that you have to do something about too. So you can't just flip the switch completely the other way just yet.
I mean, think about like with cancer treatment. I mean, we're a lot better at preventing cancer now than we used to be. We're a lot better at detecting needs early, but we still got to treat people with stage 4 cancer. I mean, we still got to do everything we can. And so we're finally now doing the stage 4 at something that approximates maybe what's necessary, but we got a long ways to go on the prevention side. And Chris, do you want to also take the question that just came up about prevention and health promotion?
Yes, please. Yes.
Because that's important, y'all. And I think that's where the state is moving in that direction. And I think the partnerships through the consortium are important on that. Because what they do is they say, we've got your back if something serious emerges. But really, it's still to schools to and families and communities to intervene earlier. And I do think that the funding that's in the school safety allotment, if it can be used for mental health purposes, and schools who are looking to have an infrastructure there around being able to fund more capacity internally to look preventatively. And I think the model for the state, one of the models for that is the mobile mental wellness clinic that San Antonio has. I mean, community partners have stepped up in partnership with schools and said, we will help you do more. So I think those types of partnerships in the community where you partner with schools allows you to not just respond when a need emerges, but to build a culture within the school that recognizes emotional development, relational development, character development as part of what's necessary for success in life. And these are pediatric illnesses. So when you're talking about prevention and early intervention, you need to think about children, because half of these illnesses begin by age 14, 3/4 by the time you're done with your brain developing in your early 20s, mid 20s. So that's really where the early intervention piece has to happen. And so that is still more, I mean, that might be something maybe in the HB 13 grants y'all could put in. I mean, if you had like kind of a broad scale partnership or something like that, that's where that could potentially fall in. But I think it's more the school safety allotment and then local funding, local foundations, cities. San Antonio, again, city of San Antonio is a model for looking upstream, looking at trauma, trying to invest more. And other communities, I think, across the state should look to what's happening here in San Antonio to get some best practices. Did I miss? Are there other pockets of funds, Nelson? I'm trying to think out there that might be able to get further upstream.
I mean, there's some things at the federal level as well. There was 3 rounds of ESSER funding that came out during COVID. And of course, that was not just for COVID related learning loss, but that was for emotional and mental health needs for that. Those are, of course, expiring. So there's a question about what you do with that going forward. But that was significant funding that came down. We've got a large budget in Texas, but we can't compete with the budget at the federal level and the amount of money that they push down to the state. So that's another avenue I would think about as well. And speaking of that, the legislature is potentially coming back in September or October for a special session around education. There's still a lot of funding in Article 3, the education portion of the budget, that was tied up and earmarked for teacher pay raises and school funding. So a lot of this is kind of to be determined what that's going to look like after the legislature has that special session and irons out the education funding and has the school choice discussion as well. So if you're heavily involved in the education space, I would reserve your month of October and plan to get the student and teacher, really administrator wellness component of that as part of the discussion for the special session as well. So.
Yeah, I'm really glad you mentioned the special session, Nelson. And I do think, as community-based organizations, partnering with schools, I think, is probably your best approach on this. Communities and schools, other organizations like that, and then not just them, but lots of organizations that can partner directly with schools. The social determinants, what do they call? What do we have to call that in Texas? Non-medical determinants of health, something like that. But basic needs: being able to eat lunch, being able to have transportation, being able to have your parents have a job, being able to have a home, being able to have a safe home, a toxin-free home, being able to have healthy food. Those schools are probably the best partner, as is the faith community. And I think, faith-based partners being able to lean in and leverage that broader tide of goodwill and helpfulness that our faith-based organizations across our communities have. Those are the partners, and that there are ways to kind of tie those in. There's going to have to be something like a school probably for the state to fund, but there's also a lot of things that philanthropy and municipalities can be funding around that too, that kind of create that fabric. And that's a discussion hopefully we get to have even more going forward.
Hey, Chris, guys.
Can I?
Yeah, go ahead. Go ahead, Andy.
Well, I guess I want to expand the discussion, talk about is prevention and substance use disorder treatment, because Nelson mentioned the federal funds that have come out, and the federal government put a tremendous amount of funding out there into the substance abuse world. But the Be Well Texas initiative, which is headquartered out of San Antonio. I mean, Jennifer Potter and the team at UT Health San Antonio really brought that, and it's a statewide set of partners, I think over 100 partners across the state that are doing telehealth-based substance use assessment, treatment, including medication-assisted treatment to help people. And I think leaning that more into the youth lane, there's going to be some funds through the opioid settlement coming online this year. There's also there are additional federal funds through there that Jennifer and her team are going to be putting out bids on. So in the adolescent substance use disorder space, there is a lot more that needs to be done, and there's some resources that frankly are going unused. So please talk with us, talk with our friends at MHM if you have questions about that, because if you would like to do more, or if you have community partners who would like to do more in the substance use prevention and early intervention lane, or just intervention, the whole gamut, because we're lacking on all levels, let us know, because there's absolutely some opportunities this fall that are going to be out there.
Thanks, Andy. Just had a question back a little bit in the weeds. The multi-systemic therapy teams, what do those look like? Who are the providers involved in those type of teams?
Yeah, so the funding's going to go, the new funding is going to go through local mental health authorities, and they'll either directly operate those teams, or they will contract with youth serving agencies that are good at community-based services. And there's a lot of them in Texas and nationally who can partner with them, or partner with their probation departments, because historically probation departments were really where youth probation departments were where MST teams resided. So the team that's one of the longest standing ones in Texas and one of the best ones out there at Harris County Probation, they're great partners in this too, because you want that you can intervene, when a youth gets into the justice system or is at risk of that, but we really want them available before that, which is why the local mental health authorities are the kind of provider of choice through the state. So what they do is they have a team that it consists of two people that are the core of the team, and a full team has two-person sub-teams on it. And they're able to intensively deal with just a handful of youth and families at a time. So 6 or so families at a time that they help. And they work super intensively with the people in that young person's life. So yeah, I mean, many of these youth have anxiety or depression. The Uvalde, the young man who carried out the Uvalde horror, clearly had signs of depression. I mean, I can't diagnose him from afar, but I mean, the things he described were, the media has described, were agitated depression symptoms. That's something that would require clinical intervention, but that's not the main thing that a youth getting MST care needs. They need that, but they need somebody supporting their caregivers and saying, hey, how do we put a plan together so that after school someone's watching this young person? And who are the other people that can support you? Because caregiver, you probably can't do all this yourself. You need people around you. Who's at your church? Who are your neighbors? Who's at the school? Who are the other people? And they build that. So in the first month, it's super intensive marshaling all those folks. And then it usually lasts about 3 to 6 months. So by the time you get to month 5, you've put that structure in place, or in a small number of the cases, you figured out you can't. And that's unfortunately true. We have too many youth who don't have any adults, and we can't get any adults to step up and be part of their lives. And so again, that's where faith communities, other community partners are essential partners to these MST teams, because we need you to help us figure out and be part of what's knit together around these young people and their caregivers. Because if it's a grandparent or an aunt or a cousin who's in that caregiving role that they didn't expect to have, that they ended up stepping up to be the family member or the friend who was willing to take that on, they need probably the most support of anybody, because they're the critical person in that youth's life. So that's how they work. And there's a huge evidence base on it. We're happy to share more information if you have questions in your community about how to do that and how to make that. And there's a lot of people who are ready to help too. There's training through the state. So there's a lot of support. So if you feel like, wow, our community would like that, but that sounds hard. It is hard, but it's not rocket science. And there's a lot of people out there who will help you figure it out in your community.
Thanks, Andy. Just one more quick question before I think we're going to close up. Purchase psychiatric beds. Here in Bexar County, we work to bring a lot of those to the San Antonio area. And we did get a few, but 193 total across the state. Do you think this is enough, or is this, because I feel like the estimate, it should be much higher for those purchase psychiatric beds?
Yeah, I mean, like just in San Antonio, they wanted 100. I think the state, this was an argument that frankly only got advanced, I think, because of San Antonio. Had Stick not pushed this forward with the aggression, I know some of you on today were maybe part of those hearings where like certain legislators weren't as nice to you as you might have hoped they would be, but that's because you were pushing them to do more. So thank you for doing that. So I think, yeah, there should be more, but the fact that they raised the rates, added competency restoration beds, which they'd never directly funded those before in a targeted way, and expanded bed capacity, I mean, it's a win. It's a win. Chris, can we please take that last question that just came in? Okay. Do you want to tell them what the question is in case people aren't reading?
Trying to unmute myself. So why do you believe the state, Texas, was ranked last in terms of access to mental health services?
Because certain people have political issues they're trying to push. I'll tell you what those are. And the media is obsessed with oversimplifying things. So the base of these things are the Mental Health America rankings. And the Mental Health America is a fantastic, Schroeder Stribling, we love Schroeder. We work with her nationally, and they put these out. And if you read their rankings, they say, these are not meant to be used to compare one state to another in terms of its overall system. They're meant to look at the specific issues that we look at and to be able to look at how you could do better. So the biggest driver of those ratings is, are we a Medicaid expansion state? And yeah, you're right, y'all. We aren't a Medicaid expansion state. And there's a discussion to be had on that. And that's an important thing for people to talk about. They don't, however, look at the fact that we have this 1115 waiver that brings billions of dollars, including $500 million a year into our mental health system. That's not on their radar. They don't count that. So that's number one. The other is people oversimplify the rankings, and there is a political agenda in there, which is, I think, a valid one, to have a discussion about what our role of Medicaid should be. But the other thing is, all the data are from 2019, because any report can't look at current data. You're relying on old data. So that's before the consortium was launched. So all of this cool stuff that we're talking about for children had not been invested in the state of Texas. And also, I'm not sure the rankings are adequate to capture that, because they rely on federal survey data, and the feds don't really survey data like this. So I think the only substantive thing I would say, other than, yeah, we need to talk about the role of Medicaid in the state, not for children. We have Medicaid for children. We could probably talk about how that could be a better system. But the only substantive question there is follow-up for depression care. That's the one in there that we think, and we've said this, you can look at our website where we debunk these oversimplified buzz thing. What do they call that? The thing in the media where they're trying to get you excited and angry about something. That's what it is. So if you're excited and angry about it, the media successfully manipulated you. And if you'd like to understand it better, you can go to our website and read our briefing where we get into all the data. And there are some things we could do better, but that's true everywhere. And I don't think it's very helpful to talk about, these rankings other than what I just said. So thanks for letting me.
Absolutely. And appreciate that, Nelson. Andy, thank you again for putting on this today. I'm going to turn it over to our president and CEO, Jamie Weslowski.
All right. Well, Andy and Nelson, I can't thank you enough. As always, you were awesome. Thanks so much for sharing some of the key wins in mental health services that were passed this legislative session, and for everything that Meadows Mental Health Policy Institute does to support and improve the delivery of mental health services in our great state. Our thanks to many of you in the audience who spent time in Austin meeting with lawmakers, testifying at committee hearings that stretched on for hours. Your voice truly made a difference. Our work now continues as we stay engaged this fall to ensure new laws and programs are implemented as intended, as well as to continue advocacy efforts and push for key public policy initiatives to be added to the House and the state interim studies. So thank you all again for joining us. Have a great day, and God bless you all.